Maria,
My name's Esther.
and we'll be talking about sustainable strategies for addressing child malnutrition in South Sudan.
Child malnutrition is an urgent issue in South Sudan caused by conflict, economic hardship, and climate change. This presentation explores sustainable strategies to address the crisis.
So, the history. On July 9, 2011, South Sudan gained independence from Sudan. 99% of voters chose to secede from Sudan, and that's why they became the world's newest nation. While independence was a significant victory, it did not bring lasting peace. South Sudan has also faced decades of conflict and instability. And these decades of conflict and instability has left South Sudan with weak infrastructure, limited access to education and healthcare, ethnic divisions, and food insecurity. War has also increased South Sudan's dependence on humanitarian aid.
And then politics, there was political tensions creating ethnic division. And this example is the divisions along the lines of Dinka and Nor ethnic groups. And peace agreements, they were broken, which led to political divisions. Economic growth stunted due to conflict and corruption. And the combination of economic instability and political turmoil has exposed children to malnutrition, which the families and the children are faced with hardships and malnutrition.
So, the culture, religion, and bridges to the gospel in South Sudan. So, South Sudan is a diverse and ethnic and has diverse ethnic and linguistic groups. South Sudan has 19 major ethnic groups and 145 different languages, and around 600 subgroups living in Sudan, according to World Trade Press. So, South Sudan has a mix of Christianity, Islam, and animist beliefs. About 60.5 identify with Christianity, 32.9 identify with folk religion, and 6.2 is Muslim. So there is a growing influence of Christianity blended with traditional African beliefs and practices. Also noted by the Pendle 2023, religious thinking is changing in South Sudan as Sudanese people are needing to make sense of war and the trauma that they're facing. So they are turning to Christianity as an outlet and as a source of comfort and peace and as a framework. But they do have traditional practices and beliefs that they're blending in with Christianity to make sense of what they're going through. And then also, South Sudan is a collectivistic society. South Sudan values the principle of unity and diversity, group cohesion, and addressing the needs of the whole community.
And then moving on to the health in South Sudan. Malnutrition in South Sudan is a public health emergency. And actually, 1.4 million children under the age of 5 are facing malnutrition, and including more than 300,000 suffering from severe malnutrition. This causes limited access to healthcare services, clean water, and sanitation. And then economics, more than 80% of the population living below the poverty line. Inflation, high food prices, and disrupted agricultural activities have left millions unable to afford basic food items. And lastly, education, hunger and malnutrition impair cognitive development, concentration, and school attendance, which that causes children not to do the best in school because of malnutrition. And schools in war-torn areas face shortages of resources and meals, hindering their ability to create a supportive learning environment.
So next, social needs in women, children, and environment in South Sudan. So women, they face the highest mortality rates in the world. Moreover, children and women are some of the most overlooked people in South Sudan, impacted by malnutrition, discrimination, educational barriers, and a lack of health care. And gender-based violence is also what they face. And then this prolonged conflict has exacerbated food insecurity and poverty. And so, with this highest maternal mortality rates, according to the Central Intelligence Agency, the maternal mortality rate ratio is 1,223 deaths per 100,000 live births. This means that there's a shortage of healthcare workers, facilities, and supplies, poor roads, a lack of transport, and cultural beliefs that prevent women from seeking obstetric care. So for seeking healthcare and ways to help them in birth. And then, moreover, like I said, women face barriers to education. They have low levels of literacy. They face social norms and traditional gender roles that are pushed on them. And then they also face mindless violence, according to World Trade Press 2025. There are some women led nutrition initiatives for community growth that UNICEF has highlighted, where women come together and they learn and they educate themselves on ways to end child malnutrition. So, in regards to child health, 148.1 million children under the age of 5 are too short for their age, and 45 million are too thin for their height due to malnutrition. And the main drivers of this are food insecurity, poor macroeconomic conditions, extreme climate, and spiraling costs of food and fuel, according to UNICEF 2022. Moreover, COVID-19 has severely exacerbated and affected malnutrition and has rolled back decades of progress that people or organizations have already been making to fight this fight. And this disruption has increased vulnerability children have to malnutrition and to preventable diseases. So there is a need for sustainable organizations and strategies to come and fight malnutrition and tackle what is a very much a health crisis. And Uribe and Ashing 2021 highlight that this mobilization to tackle malnutrition needs to happen, or else by the end of 2022, 14 million more children could suffer from wasting and 30.6 million could face stunting, leading to additional economic losses of about $44 billion. According to the environment, water scarcity, soil degradation, and pollution affect South Sudan. And they have communities face a lack of drinking water. And then they also, because of that, inherit waterborne diseases. And then the impact of droughts and floods affect agricultural production that South Sudan has.
Christian ministries addressing child malnutrition in South Sudan. We have two examples. First, Samaritan's Purse. This is emergency nutrition support, ready to use therapeutic food, and training and education of mothers. So they've been working in South Sudan for years, providing emergency nutrition support for children suffering from severe malnutrition. And then moving on to World Vision, we have emergency food aid, sustainable farming initiatives, work with local health facilities. And their programs address both immediate needs, such as distributing emergency food rations, and long-term solutions by training families in climate-smart agriculture and nutrition. So they both focus on long-term solutions beyond aid.
So for the faith-based development strategy, we wanted to think about a faith-based strategy that has the integration of faith. It's a community-led approach, that it is sustainable, and that it empowers communities, and that there is discipleship. So the faith-based strategy would address both the spiritual and physical needs of the people, and that it would be holistic and it would address the whole person. And so the intent is that this will be, like I said, sustainable, community-led, faith-fueled, and centered around around empowerment, food security, and spiritual transformation. So the goal of this development strategy is that there would be a faith element to it, that it'd be long-term, and that it would empower people to overcome the factors they recognize as diminishing their human life, according to Mitchell 2017. And this will also focus on 3 core frameworks, such as sustainable agriculture, discipleship, and empowerment. So the community-led approach we took from the fact that South Sudan is collectivistic. So with this community-led approach, they would have community-led food and farming initiatives, and then the community leaders would also be trained to disciple and oversee agricultural efforts. Moreover, they could create faith-based Bible studies and really be able to incorporate the whole community and feel like they're being empowered because they get to lead it themselves. The next would be sustainable agriculture. So this would be rooted in stewardship, because South Sudan has a high emphasis on stewardship. And then they would teach communities to use sustainable farming techniques. Next would be discipleship and empowerment. so that we would help communities to empower themselves, and we would create have empowerment over dependency. So the thing that we would highlight is borderless discipleship. In this, as it relates to South Sudan, is discipleship that gets rid of external boundaries that would keep South Sudanese people from actively living out their faith. Discipleship is combined with the concept of empowerment could look like, we said, training local community leaders to establish faith-based communities themselves. And then the integration of faith is so important. Faith is foundational to our development strategy. And in a quote that is stated above in our paper, Mitchell 2017 highlights that faith is foundational and should infuse the whole operation, and it should address both spiritual and physical needs. So the 3 core points are that addressing child malnutrition is multifaceted and it's going to take many solutions. The next is that sustainability is key, and that faith-based organizations can be crucial in holistic development. Thank you.
Thank you, everyone.